So Teton County is made up of 2.7 million acres. Only 3% of that is for development. So 97% is federal, private land, public land. So we encompass all of Teton National Park, 40% of Yellowstone National Park, and 96% of its water surface. So our income disparity, Teton County, we have the highest concentration of wealth in the United States, and we have the highest level of income inequality. So the top 1% of Teton County is making 142.2 times more than the bottom 99%. So that's, the top 1% is making over $22 million a year. And a median household income is $108,000. Only the national median house income is a little over $80,000, $80,629. So we are a tourist destination. That is our largest economy. Millions of people traveling here from all over the world. In the summer, we receive between 3 to 5 million people that are coming through. In the winter, around 500,000 people are coming to ski and spend winter here. So out of the 21,919 jobs, 72.1% are service-related, so hospitality, service industry. And of the 9,993 workers of those 21,000 jobs, almost half, they are commuting from other communities outside of Jackson Hole. They're coming from Teton County, Idaho. They're coming from Lincoln County, Sublette County, Fremont County, so they're traveling a great distance. And then they're dealing with the weather and past closures because of avalanche and other uncontrollable circumstances. We made national news. Maybe many of you here did see the news if you weren't here living it, but a lifeline to our community for a part of our workforce, like the mountains collapsed, like literally, the pass went down. So that resulted in people having to drive around. So that increased their commute from an hour and 15 minutes, to 2.5 to 3 hours. That's a long work day. So affordable housing, another crisis for us. The average single-family home is topped at $5 million, and this was the end of 2022. That doubled from 2019 when the price was $2.6 million. The Wyoming Cost of Living Index, fourth quarter 2022, Teton County was 67% higher than the statewide average on the Comparative Cost of Living Index. Average rent for a 2-bedroom apartment in Teton County is a little over $4,100. It is very common that multiple families are living in a 2-bedroom apartment. So that means a family of 4 in each bedroom, sharing the communal space. It is also very common for a family of 4 to be living in a studio apartment of about 450 square feet, a family of 4 living in that. That's extremely common. Unhoused, again, very common. This summer, in August, during our Community Prevention Coalition meeting, it was reported that our Children's Learning Center, Head Start, they were working with 6 unhoused families living in their cars. Can you imagine? Home is our foundation, our safety, our security, our comfort, and it's very limited here. Paradise paradox, you heard Paige speak of it. Paradise, being somewhere where it's complete bliss, right? And it isn't just communities, mountain communities. It's also beach communities. But it's the picturesque quality of life, the kind that is full of gorgeousness, freedom, wide open space, clean mountain air or clean sea air, abundant, intense recreational opportunities, very specific to mountain resorts, daring outdoor adventure, risk-taking, wildlife, and just feelings of well-being. That is paradise, right? That is bliss. Who doesn't want that? That's amazing. But the difficult reality, so the paradox of that is the contradiction. Living a fantasy that's hard to obtain. Affordable housing, or any housing. Working multiple jobs to afford housing. The amount of people that are staying in unhealthy relationships because of housing. They're living in a home, in an unhealthy relationship that's impacting their well-being because they do have a job and maybe there's connection, but they don't have anywhere else to go to live, so they stay living in that situation, exacerbating. And the other thing is those working multiple jobs, which is very common. 2 to 3, very common. So you come to the paradise because you want the bliss, you want that happiness, you want to experience what you love so much in the mountains and recreating, but you're working multiple jobs. So that's impacting your time. So you're not getting out to do the things you enjoy that bring you happiness, that provide mental health, movement, scenery, connection to others that are also doing that. That's limited then. So everything's changed. The paradise is completely changed. It isn't reality anymore. But yet, again, you're living in one of the biggest tourist destinations. So everyone who's coming, and those 72% workforce that are working in hospitality and service, they're seeing that. That's a good time, right? They're hearing about what people are doing and experiencing, and that's what they came here to do, but they're not able to because they're working so much. Loneliness, isolation, also very real. Thinking of connection and recreating and being outdoors. Honestly, how much of a valuable connection can you make to someone riding a chairlift? Because then you get off and you're skiing on your own. So it's conditional. Conditional connections. Are you part of that community that's into the recreating, whatever it may be, whether it's skiing, whether it's hiking? You're still doing something individually because safety is number one as you are recreating and you're moving and you're doing what you love. So the connection with the individuals, it's conditional. And is it quality? It's better than nothing, but it is also isolating. Seasonal fluctuations, long winters, short summers, uncontrollable weather, when power goes out, roofs collapse because of the amount of snow, passes, avalanches in commuting mountain canyons and passes, all those things impact. Again, remember how much of our community is commuting in. That's teachers, healthcare workers, service, hospitality, a lot of human service positions, community support, what keeps the community going. It's constantly compromised. Altitude. And again, back to the outdoor access, not equally available, and the lack of inclusion. It's expensive to ski, all the equipment, the time. That isn't equally accessible to everybody in our community, not a lot of our workforce. Plus, it's intimidating. Because we talk about athleticism and we're so competitive and how much vert did you get in? Well, maybe I just wanted to sit and read a book. So that's tough. So the vacation party culture, like I said, a global destination for a great time. Tourist economies, mountain resort communities have higher rates in drug and alcohol misuse. Recreate hard, play harder. We conducted a University of Wyoming Survey and Analysis Center, which works with community preventionists and the Wyoming Department of Health to do surveys and to study prevention, conduct the prevention needs assessment in our schools. We held a parent focus group around underage drinking, and this is the kind of things we heard. Last call, first chair. That's how people that grew up or moved here, that was how they lived their lives. So last call for alcohol, and then first chair, you want to be first in line to catch that chair to head up the mountain to take your run. So Teton County has 156 alcohol licensed venues. Again, a community of around 23,000 people. Natrona County, which is Casper, Wyoming, one of our largest, second largest communities in the state. They're 4 times our population. They have 127. That's a big difference. So mental health, we know it's not one cause. Cowboy up culture, Wyoming, frontier state, we're known as the cowboy state. Rugged, self-reliant, independent, handle your own. Well, you have to when you're a frontier state, because all those that are working in agriculture, all those that are working in natural resources, you have to be independent. You have to be self-reliant, because there aren't neighbors and there aren't people for miles, hundreds of miles, that are there to support and help and get you through when you're out with your cattle or you're out farming or whatever it is. You have to be self-reliant. That can prohibit someone from seeking help. Pull your bootstraps up. Come on, camper. So, comorbidity of mental health conditions and substance use disorders. Physical and mental health conditions with non-medical use of substances to cope. Another thing about mountain resort communities and where it's a recreation hard, play hard, injuries, right? Risk-taking. Your body doing difficult things, hiking, climbing, running, and the trail running, skiing, all these different things, it takes a toll on our bodies. Injuries from risk-taking, falls, that then also prohibits your ability for movement and to recreate. So then medications, non-prescribed, may come in. Coping, drinking, illicit drug use, all those things again impacting paradise and then paradox, the struggles. High rates of suicide. In 2021, someone in Wyoming died by suicide every 60 hours. Wyoming held the #1 spot for highest number of suicides per capita for 3 years in a row, at double the national average. Historically, Wyoming has been in the top 5 states, top 3, really, for suicide since 1996. It's not a place we want to be. Mountain West communities have higher elevations, so less oxygen to the brain. Hypoxic, mental health stress, it evokes psychological effects, including depression, anxiety, suicide ideation. We know when tourists come from sea level or lower elevations, things affect them differently. Alcohol, affects them differently. Getting out and recreating and not having their systems used to the elevation. So we know for visitors, there's definitely impacts and adverse events. So imagine living here for years and years, and there's studies around this. Frontier communities have limited access to care and services, including the ability to pay. Teton County has an immigrant community estimated at about 30%. Our schools, much, much higher than 30%. Access to culturally and linguistically diverse care, it's lacking. Unmet behavioral needs go beyond supply and demand issues, including limited scopes of practice, low reimbursement rates, resource constraints, tough regulatory burdens, and provider burnout. So for Wyoming, Teton County, we're actually really lucky here. We average, it's one provider per 160 residents. That's pretty good. That's way above the state. That's even above national. Other communities in Wyoming, even Montana for that matter, there could be 1, 2 providers, nurse practitioner, but they're also the OB, they're emergency room medicine, and they're also helping when someone's in crisis and feeling desperation. Other communities, the providers are so limited, the communities are so small. Plus, remember, cowboy culture. Pull your bootstraps up. You got this. So are they really going to walk into a clinic that is known that there's a behavioral health professional in there? That's hard. Again, pull your bootstraps up. You got this. Support and hope for mental health. So this is all about community. Public health is community. Prevention is community. It's robust here in Wyoming. So we work within shared risk and protective factors model to improve multiple population outcomes, impact social determinants of health in ways that are positive and equitable, and engage partners across multiple disciplines and sectors through the community prevention coalitions in every county in the state of Wyoming. So I have 22 counterparts, or a few more because some counties have 2 community prevention specialists. We have a saying in prevention, well, we say community is prevention, but we also say there is no us without us. So for us, for Teton County, our Community Prevention Coalition is made up of invested community partners from law enforcement, Jackson Police Department, Teton County Sheriff's Office, our school district, St. John's Health, Teton Youth and Family Services, Mental Health and Recovery Services of Jackson Hole, Children's Learning Center, Teton Behavioral Health Alliance, Voices JH, retired community members that just really care about suicide prevention and substance use. Our faith leader, St. John's Episcopal Church. Nothing about us without us. So all these community partners coming together to find solutions, to support programs and enhance them. So something else about coalitions and communities. I want to share last year, one of our other schools, a private school, college readiness school, their seniors are required to do a senior project. So last year I had the honor and privilege of a senior student reaching out to me who wanted to do her senior project apprenticeship in prevention with the coalition. She spent 80 hours working with me and our coalition, doing community outreach, doing different programs for like drug take-back days for safe disposal. We did a youth mental health survey around students, how comfortable they were with talking to friends about mental health issues, they themselves, just an array of questions. At the end of that 80 hours, it was 81, that's actually what it calculated out to when she was done, there was a public symposium where she then provided her presentation on her time with the community prevention specialist and the coalition. And the one thing she said that was so amazing was that, and she had no idea, she said, it was so amazing to sit in these coalition meetings with all these caring adults that are working to make this difference, to make our communities feel better. That was her main takeaway, is that she was just so inspired by that. And support of these students. So this specific student, Teton Youth and Family Services and Mental Health and Recovery Services, this particular student was going on to study psychology, and she was given a scholarship by our organization to continue to support her. So youth prevention coalitions, we have those throughout the state. And I can also share with you, community prevention specialists attend CADCA every year. Formerly, it was known as Community Anti-Drug Coalitions of America. So we meet in Washington, D.C. for 3 days of amazing education from top thought leaders from all over around substances. The drug czar is there. It's truly amazing education. And then we spend 1 day on Capitol Hill, going and meeting with our legislators. So for Wyoming, our congresswoman, and then our senators. So last year, during CADCA, we had 4 high school juniors from Washakie County, so Worland, Wyoming, who attended with us and came up on Capitol Hill to speak to our legislators. And we're talking about all the different bills around 988, expanding mental health care, and STOP Act, CARE Act around substance use and underage drinking. And it's amazing that these kids get up in front of these adults with so much power, and they're sharing a story about losing a student, a classmate, to suicide months previous. They talk about it, they feel it, they want it to change. Those are our youth coalitions. We have peer-to-peer advocacy groups, leadership programs throughout Wyoming. Here in Jackson Hole, we have Lose the Fuse. This is known actually, it's known throughout the state now. Here's these kids struggling from vape use, nicotine addiction, struggling, affecting them physically, mentally, and they want to quit. And who knew that flavored liquid had so many toxins and was so extremely addicting? So these kids come together, they support each other in cessation and quitting. They talk about it, the struggles of it, with the support of the school district, the school, high school nurse, Community Prevention Coalition, and they are like helping each other, influencing each other to feel better, to do better, supporting each other, talking openly about it without the fear of repercussions. That's amazing. So community prevention specialists in Wyoming, we have a very beautiful relationship with our law enforcement. So WASCOP, Wyoming Association of Sheriffs and Chiefs of Police, and the Wyoming Prevention Action Alliance. So we're doing statewide initiatives to reach communities in every way and meet them where they are. The Wyoming Alliance for Suicide Prevention, also known as WASP. It's a statewide coalition of professionals, state agencies, and local representatives who work collaboratively to drive effective suicide prevention strategies in Wyoming. And this includes our 2 988 call centers, the VA, telehealth, individuals in private practice, CPSs, all these people that care, that are working to find solutions to meet the needs. So when 988 launched nationally for Wyoming, that was huge. All our calls, so 988 has always existed, right? It's been known as the Lifeline, 1-800-273-8255. Who's going to remember that number? Changing it to 988 was huge. Our phone calls, they weren't answered in Wyoming prior to that. They would end up in maybe Nevada or Nebraska or somewhere back east. Since we've had our 2 call centers, when you call in, they know everything about your community. They can relate to you. They understand that Farson, Wyoming is just a road. They totally get all your dealing with environmentally, culturally, and they know all your resources for that community. That made a huge impact. And then our local Teton County Community Crisis Response Agencies, Mental Health and Recovery Services of Jackson Hole, and Teton Youth and Family Services. Going back to what the student apprentice said, all these people coming together that care. That was her biggest takeaway, her biggest inspiration, her biggest hope. So again, there's nothing about us without us. This isn't you, this isn't me, it's we. Thank you.